Assalamu alaikum. My name is Aisha Babar and the topic of my presentation is development of maxilla. First of all, we need to know what maxilla is. The maxilla is the upper fixed bone of the jaw formed from the fusion of two maxillary bones. It is the second largest bone of face. Paired maxilla forms whole of upper jaw. Each maxilla contributes in the formation of face, nose, mouth, orbit, infratemporal fossa and pterygopalatine fossa. Structure of maxilla can be seen from the diagram. Features of maxilla. Maxilla has a body and four processes. These processes are named as frontal, zygomatic, alveolar and palatine and can be seen from the diagram. Body of maxilla. Its shape is pyramidal as clearly seen in the diagram. It has a base directed medially at nasal surface, an apex directed laterally at zygomatic process. It has four surfaces named as anterior or facial, posterior or infratemporal, medial or nasal, superior or orbital. Encloses a cavity called as maxillary sinus. Articulations of maxilla. Superiorly, three bones named as frontal, nasal and lacrimal. Laterally, only one bone named as zygomatic bone. Medially, five bones: ethmoid, inferior nasal concha, vomer, palatine and opposite maxilla, and can be seen from the diagram for better understanding. Age changes in maxilla. As age changes, we see some of the changes in maxilla. At birth, transverse and anterior-posterior diameter is greater than vertical diameter. Well-marked frontal process. Body consists of little more than alveolar process. Maxillary sinus is a more furrow on the lateral wall of nose. In adults, vertical diameter is more due to developed alveolar process, increased size of maxillary sinus in old, infantile condition and resorption of alveolar bone. Development of maxilla. Maxilla develops from ossification in mesenchyme of maxillary process of first arc, no arc cartilage or primary cartilage, center of ossification close to cartilage of nasal capsule, center of ossification in angle between division of infraorbital nerve. From this center, the bone formation spreads posteriorly below the orbit towards the developing maxilla, anteriorly towards the future incisor region, superiorly to form frontal process, and medially to form palate. Bony trough for infraorbital canal is formed. From this trough, a downward extension of bone forms the lateral alveolar plate. Medial alveolar plate from junction of palatal process and main body of forming maxilla. These plates form a trough of bone around the maxillary tooth germ. There is contribution of secondary cartilage. Zygomatic or malar cartilage aids in development of maxilla. Normal anatomy. Face is the region from supraorbital rims to maxillary alveolar process. Normal anatomy of maxilla can be seen from the diagram given. Functions. Now we have some of the functions associated with maxilla. Number 1. Speech and voice resonance. Number 2. Reduce the weight of skull. Number 3. Filtration of inspired air. Number 4. Immunological barrier. And number 5. Regulation of intranasal pressure. Maxillary fractures. Types of maxillary fractures are maxillary sagittal fracture, palate fracture, alveolar process fracture, Leaford fractures, Leaford 1, Leaford 2 and Leaford 3 fracture and combination. Cruzen syndrome. It is one of the syndrome that is related with maxilla. It is caused by underdevelopment of maxilla. And we can see diagram for better understanding. Thank you.